The United States, country of over 300 million people, one of the largest political, economic, and social powerhouses in the world. Today, however, there may be something that this powerhouse has failed to amply address, that of its population's most valuable asset, its health. The United States is the only developed country that has not provided sufficient health coverage for many of its most needy citizens. Today, roughly 15% of this population is completely uninsured due to the high costs associated with insurance. Consequently, this injustice most often plagues those impoverished or with a taxing illness. According to National Institute of Health statistics, 55% of uninsured Americans reported not having a usual source of care. 29% reported postponing care due to costs, and 25% went completely without care because of costs. These high statistics reap equally as drastic outcomes. In fact, the American Journal of Public Health concluded that annually 45,000 deaths are directly linked to a lack of health coverage, and that these deaths now exceed that of those caused by common killers such as kidney disease. But this is only one study among many that shows that the uninsured suffer thousands more preventable deaths than their insured counterparts. From the 70s to this date, this issue has been researched and confirmed, but with a consistent inaction. So, have these alarming statistics reached the general population? Are people aware of this issue? Let's observe the views of the residents on this issue.
Healthcare should be a right because without healthcare you could end up dying, and life is a right.
I definitely think that healthcare should be available to everyone, mainly because not everybody can afford it, because some people are living in poverty.
Okay, so I think that we all should have access to healthcare. I think that should be a human right. I think that should be an inalienable right.
Access to healthcare should be a human right.
Yeah, I think healthcare should be a right for everyone, because if you're sick and if you're poor and if you can't afford a doctor, well, then you end up dying. But
Everybody has the right to be healthy and get the treatments that they need, and I don't think you should be poor or rich to be able to get those things. So everybody should have access. Absolutely everyone.
Generally, people believe that there should be a right to health care. However, there still seems to be discontent regarding a universal health care system and the costs and government action associated with it. In fact, according to the New York Times, 50% of Americans oppose a public health care option. This discontent, primarily fueled through and by private insurance companies, has put much pressure on this movement's advancement through to legislature. Many private insurers contest that the United States economy is completely reliant on a free market healthcare system, one without high government regulations. Others challenge that a government-owned system leads to inefficiency, including high wait times and less patient independence. To see if this is a plausible excuse for a lack of health coverage, observe our neighbors across the Atlantic in France. According to the World Health Organization, France tops the health systems chart out of 191 member countries. Following France, 36 slots below, is the United States in 37th place. How has our healthcare system dropped so low? Note France in first place. All of the French are covered through a mix of government and private insurance. Yet, citizens still get choice in hospitals and doctors, and there are virtually no long wait times to schedule an appointment. These facts contest most prejudices about universal healthcare systems. But isn't this too expensive of a healthcare system to maintain? The cost is, in fact, quite lofty. France boasts one of the most expensive systems in the world. But what's more alarming is that the US system is approximately twice as expensive as France's per capita. Thus, the US system tops the charts in cost, yet not in coverage or overall efficiency. So, now that we've observed France's accomplishments, how can the United States become a world leader in healthcare? Reform will not be easy, but it never has been. Since Lyndon B. Johnson and the implementation of Medicaid and Medicare, healthcare has been a controversial issue in the United States. In order to meet the demands of the companies and population alike, a proper system tailored to the U.S. must be employed. A good alternative to the entirely government-appropriated insurance would be to adopt an insurance mandate system. This system is similar to that of France's in the sense that both government and private-issued insurance is used, and that all citizens require the purchase of insurance. However, this type of system is less government-based than France's, relying more on regulated and standardized private companies than government-issued insurance. This helps prevent from common downfalls of the current U.S. system, including overpriced insurance rates or the rejection of sick individuals from insurance plans. Those who still cannot pay would still be insured through the less widely used government insurance. Now, it is imperative that the public be educated to the various forms and truths about universal health care. This edification should start through awareness campaigns, revealing the inefficiency of the current insurance policies in the U.S. Furthermore, such information would erase misconceptions that many citizens do have on universal health care. This revelation would open the eyes of America to the possibility of truly having a country where life is an unalienable right.